Back problems. A true cause for concern. As an investigator, my goal is to uncover the evidence and establish the truth and lead to osteoporosis. Jenny is in the 3rd trimester of her pregnancy. And for the last few weeks, her back has been killing her. The extra weight from the pregnancy has settled around her abdomen and hips. It's in your best interest to maintain the strength and health of your back. It's the only one you get.
I've always been able to keep it under control without doing anything special. It's only within this past year that it's been what I would consider moderate to severe. There are days where I have trouble breathing and I feel as if I can't pull any air into my lungs.
I've been having some problems with my blood sugar lately. It has been feeling low. When that happens, I feel like I need to eat some chocolate or drink some soda fast or I start shaking.
Tasha writes on my paper and they give me a bus pass. How will I get to work? This is bad. This is very, very, very bad. She left too early. She left. Only had $3. That was all my money. Can you give me some money? Can you go get my papers, go get my money. Go get her or else I'll hurt you. I'll hurt you.
Because of your actions, you were able to help Jeffrey de-escalate, find Tasha's supervisor, and get his bus pass paperwork signed.
To begin, check the individual's O2 saturation. If using a canister, attach the flow regulator, twisting the T-handle to secure. Note, some O2 canisters have built-in flow regulators. If using a concentrator, apply a Christmas tree adapter or attach a humidifier bottle if using. Connect the tubing to the O2 source. Ensure the rate is set to 0, then turn the O2 on. Pat area dry with gauze. Insert one end of the new tie through the opening of the faceplate, pulling until ends are even. Leaving the old tie in place, insert one end of the tie through the opening in the catheter, insertion site, and surrounding skin for redness, swelling, pain, drainage, and bleeding. You are now ready to apply the new dressing using sterile technique. Open the dressing kit, then apply sterile gloves. Cleanse the insertion site with chlorhexidine swabs using a back and forth motion, both vertically and horizontally, for 30 seconds. Cleanse the area where the catheter rested against the skin last. After cleansing, allow the site to air dry for 30 seconds. Do not blow or wave over the site. Apply a skin protectant to the area.
Gently pull the skin taut with your non-dominant hand approximately 1 inch below the site to stabilize the vein. If using a butterfly needle, grasp it by the 2 tabs. Insert the needle bevel up at a 15 to 30 degree angle into the vein. Stop when you feel a pop, pulling back on the plunger gently to verify blood return. Obtain the volume of blood needed, then release the tourniquet by pulling on the looped end. Place a gauze pad over the insertion site without pressure and remove the needle in a straight line.
If we look at typically developing kids in terms of when they typically achieve continence, it's usually between the ages of 2 and 4 years. And this seems to happen relatively naturally for most of these kids that are typically...
My name is Nate Call, and today I'll be presenting on variations on functional analysis methods, specifically how to assess function when a typical functional analysis is not feasible.
And I'm a clinical chaplain. And today I'm going to talk to you about cultural considerations at the end of life, including spirituality and religion.
Hi there. Thank you for joining me for Kratom, the non-opioid. And I'm a licensed professional counselor supervisor as well as licensed clinical addiction specialist.
When this happens, it can result in degenerated discs, pinched nerves, herniated discs, and a myriad of other back problems.
That sounds painful. I've had a herniated disc before. It is not fun, Dr. Anderson. not fun at all.
Right, they can be excruciatingly painful, but the damage is generally realized long before the pain is experienced. Improperly lifting something or lifting something that is too heavy can result in damage to the spine. It is a gradual and cumulative process.